Airing first on Asheville FM, WSFM LP 103.3 in Asheville, this is The Final Straw Radio, a weekly anarchist and anti-authoritarian radio show broadcasting out of occupied Salagi land in southern Appalachia. We bring you voices and perspectives from projects and struggles all around the world.
First, we got to sit down with Hill Brown, who works with Asheville's Steady Collective doing harm reduction outreach to people experiencing homelessness and addiction. We talk about a lot of topics, including how the current health crisis has affected Steady's operation, how the city of Asheville is mishandling its resources right now, and how folks can plug in and have advocacy with this work.
Then we'll be hearing from Jason Renard Walker, an incarcerated journalist and activist at the Clemens Unit near Amarillo, Texas. Jason is the Minister of Labor for the new African Black Panther Party prison chapter, and his writing is frequently featured in the SF Bayview National Black newspaper. Mr. Walker's answers will be read by his girlfriend, Noelle. You can find more of Jason's writings at his blog, jasonsprisonjournal.com, including a link to his recently published ebook, Reports from Within the Belly of the Beast, Torture and Injustice Inside Texas Department of Criminal Justice, available from Amazon.com and hopefully soon in paperback. More on the new African Black Panther Party and United Panther Movement can be found at rashidmod.com. A transcription of this interview can be found at our website and in the show notes. TFSR is a proud member of the Channel Zero network of anarchist podcasts, and here's a jingle from another member of CZN.
Ransom Notes. Anarchist and anti-authoritarian music podcast.
That's going to come out every month.
Ransom what? Ransom Notes. So what's your ultimate goal, I guess, in this?
We out for the rising up against the oppressor.
Attitude that you see in hip-hop.
Let me give you a sample of some of the lyrics that had some of the older ladies among the stockholders white with dismay.
Go to ransomnoteshigh.libsyn.com
or get them from the Channel Zero network.
Of note from another member of the Channel Zero network, if you are tired of Netflix and want something else to watch, the latest and final edition of Trouble, the documentary that Blue JBC often shows the first Friday of the month at Firestorm, is now online and available. I was lucky enough to do the narration for this episode. I hope you enjoyed as much as I did. You can find it at sub.media/trouble, along with all of their past episodes and other videos. Also, check out our website in coming days for this month's edition of Bad News, an hour and a quarter of roundups of news, opinions, and resistance from anarchist voices from around the world, also up at a-radio-network.org. And now some words from anarchist prisoner Sean Swain.
Okay. So in the world of coronavirus oversaturation, I've got good news and I've got bad news. The good news is the delusional hierarchs in charge of our global clown show are planning on getting things somewhat back to normal. The bad news is the delusional hierarchs in charge of our global clown show are planning on getting things somewhat back to normal. Here's what I mean. One of the unintended consequences of this global lockdown has been greatly reduced carbon emissions, as just one example. Because we're all locked away in our homes, cars and planes aren't burning fuel. Lots of factories are shut down, or they're operating in a somewhat diminished way, and our air is cleaner. What do I know? But I suspect this short break has gotten everything cleaner. Seals and polar bears and owls are all cheering for coronavirus. They're hoping this lockdown lasts a few decades. So's the ocean floor, and the permafrost, and the polar cap. Well, you get the idea. The air is so clean, folks in China wouldn't have to wear masks if they didn't have to wear masks. You can breathe the air in Beijing for a change. It's no longer like sucking on a muffler. And why is this important? Well, I've done some reading by a lot of science nerds with really big brains, and they indicate that we are in a seriously precarious situation. By some estimates, we've now got less than 12 years to radically reduce our carbon footprint, or else we reach a kind of point of no return. Meaning, that whatever we do, even if we shut down civilization altogether, life on the planet is doomed. In other words, once we hit that threshold, no matter what we do after that, the permafrost will continue releasing more gases. Those gases will continue contributing to global warming. Global warming will continue melting the permafrost. Cataclysmic systems failure, game over, nothing lives. So, ever the optimist, I'd like to propose that this zombie apocalypse lockdown is a sign of what is possible. It was a short break, certainly, but it gave our world a moment to heal. I'm suggesting that if we put our minds to it, if we dedicate ourselves wholeheartedly, perhaps we can extend this break long into the future. I don't mean staying locked in the house. I mean preventing the global production and distribution systems from gearing back up and toxifying the world. I mean kicking a crippled civilization program while it's down, so it never gets back up. Consider, for centuries, we anarchists have been thinking and talking about strategies and tactics for taking down the larger hierarchical structure. We've attempted to organize strikes, and we've carried out political assassinations, and we've pushed insurrections. We've even hacked the enemy, but we were not able to shut down the entire system. We weren't successful in turning any crisis for capitalism or hierarchy into game over. It took this coronavirus to accomplish what we couldn't. But now that it has, let's just go through some imaginary exercises. We have time for it. Let's think of all the industries, all the stuff that's shut down, and how all of it is interconnected and interdependent. It's all very complicated, vast and complicated. And even the smartest economists and the capitalists with the biggest brains are completely clueless. This is really a new thing, never been done before. Restarting an economy that's been shut down. And not only that, but resuming an economic system while putting into place all kinds of safeguards so that this doesn't happen again. We're talking about all kinds of automation where it never existed before. And we're talking about interactive offices where no one leaves their homes. An approach where social distancing is built in. A kind of new normal. That's an enormous task. In scale and magnitude, bigger than anything capitalism and civilization has ever faced. Ever. I mean, 16 million Americans lost their jobs in just 3 weeks. Now, consider also, this must be undertaken in a global economy, where some parts or technologies are assembled from several locations, and it's being undertaken while coronavirus is still raging. And any one of those locations can become the next hotspot, grinding production to a halt. This is very challenging indeed. So look at the global leadership and tell me if you think they're up to the task. And in the midst of this, they have the challenge of crowd control. Millions of people with no way to pay rent, with bills due, kids to feed, and guns, lots of guns. How do you keep food prices down while distribution chains suffer wave after wave of disruption? You see what I'm saying? This is all historically precarious. We won't get another shot like this one, where, if we really truly want the old disorder to end, it's just a matter of insurrectionary cow-tipping. One thing that those in power are presuming to be true is that all of us are just as eager to return to the old normal. The normal defined by most of us dragging stones up the side of someone else's pyramid. The normal of school shootings and endless wars, and road rage and cops shooting black people. Fracking and mountaintop removal and rainforest depletion. Dying polar bears and scorched koalas and the disappearance of coral reefs. You know, the civilization suicide cult. They're counting on all of us drinking the Kool-Aid. Moreover, they're counting on all of us being eager to make it and stir it and distribute it. I don't know about you, but I think the Trumps of the world can take that old order and shove it straight up their asses. So if you agree, here's what I suggest. You ask yourself, If I were in charge of restoring the old system, what would I fear most? Would it be someone torching the factories and schools and the equipment at corporate farms while no one's looking? Would it be hackers introducing computer viruses disguised as advice on how to combat real viruses? Think of all the things that we can do while everyone is wearing masks. We need a few good conspiracies jumping off. We can take an enormous task and make it impossible. I would also suggest that the more disrupted this order remains, the more aggravated the population becomes. And the more aggravated the population becomes, the more they wild out and seek to topple the system that isn't serving them. Now, this is brain surgery, you know. Once we get the bully down to his knees, we don't let him get back up. Ever. We can defend the future of life on this planet. Hard telling if we ever get another chance like this in this 12-year window. To quote Ted Kaczynski, we should scrap the whole stinking system and take the consequences. Hold on, Uncle Ted. You might be liberated soon. I agree with him. We need to scrap the whole stinking system before that stinking system reconsolidates and scraps us. What better time to get rolling than when the system is already scrapped? Here's to a future we deserve. This is anarchist prisoner Sean Swain in exile from Ohio at Buckingham Correctional in Dillwyn, Virginia. If you're listening, you are the resistance.
You can write to Sean Swain at his latest address at Sean Swain, number 2015638, Buckingham Correctional, P.O. Box 430, Dillwyn, Virginia, 23936. You can find his past writings, recordings of his audio segments, and updates on his case at seanswain.org, or now follow him on Twitter at @SwainRocks.
Would you first introduce yourself and talk a little bit about what you do?
Sure. So my name is Hill Brown, and I'm the co-director of Study Collective, which is based in Asheville, North Carolina. I've been with Study Collective since 2016. We're a harm reduction organization that provides syringe access for folks, naloxone distribution, overdose prevention education, safer injecting information, wound care. We also have a nurse on staff now to help with wound care for folks. We provide fentanyl test strips and several outreach sites in the city, including some mobile outreach.
How has, we're here to talk about sort of how the changing landscape of emergency access to all of the resources that you mentioned has changed due to the COVID pandemic. How has Study Collective been affected by what's going on right now?
Yeah, I think it's been dramatic. We have continued to work. We are still operational throughout the city. We've tried to maintain all of our locations. 3 of the locations that we work are indoors. One's in an apartment building, one's inside a church, the third is inside a bookstore. Of course, we can't be in those spaces anymore, and so we have moved sort of full-time into our mobile unit, which is an old ambulance. And so we're doing all outreach out of that vehicle. We have another site that has always been in that vehicle, and it was driving that vehicle to the largest public housing complex in Asheville and serving folks there. So we're continuing to work that site and our other locations as well. And we have added a location that we had planned to take on before the whole coronavirus thing, which is outside of a homeless drop-in center here. So we're working that every week. So everything's out of a vehicle now. All of our staff, we have 2 staff members, me and the nurse, we have been wearing PPE and spraying everything down and trying to be really careful about sanitation and having folks stand 6 feet away from the vehicle when getting supplies and doing all of that. I think that part of what we're doing is trying to figure out additional resources that people are needing besides what we usually provide in terms of syringes and naloxone and fentanyl test strips and just the works on clean injecting equipment. What are other things that people are needing specific to this time? And so we've been giving out lots more water so people can stay really hydrated, which is very important. right now if they were to get sick. And then a lot of vitamin C, a lot of hand sanitizer, which, is like a precious resource at this point. Mask, which people are sewing for us. We're trying to get those out to folks. And so just trying to do all of those pieces. And I think our advocacy work has also had to increase. I think some folks who typically do direct service, organizations that do direct service, are kind of putting advocacy on the back burner. And we are seeing an even greater need for that. Certainly folks who use drugs in this area are really dealing with a lot of issues around being immunocompromised, having Hep C that's been untreated, or having a history of endocarditis, or possibly having HIV. And then to add coronavirus on top of this is just really scary. And I'll also say that we have been providing herbal support for folks. So we've had an herbalist ride along. That's not something we usually have. And that herbalist has talked to folks about, are they seeing any symptoms? Is there herbal support we can provide them? Is there immune support we can provide them before a fever appears or any symptoms appear? Are they experiencing more stress than usual? Is there herbal support we can do around that? So, yeah, definitely some additional things and a change to the way we usually do operations.
Yeah, absolutely. And just based from my own observations and talking to people and thinking about what's going on right now, and also thinking about the houseless populations in Asheville and around the country, it's just how the city of Asheville is treating people who experience houselessness right now. And that sort of coupled with the whole social distancing thing is really drawing into relief for me, and I think for a lot of people, that the social distancing is really a very privileged thing for people to have access to. And if you don't have a house, you don't have access to social distancing. Would you talk about how you have seen the city of Asheville handle this topic, and how you've seen this city of Asheville handle the current health crisis as it relates to the work that you're doing?
Yeah, it's an unfortunate response, but not a particularly surprising one, unfortunately. We live in a very gentrified city. I think it's still the second fastest gentrifying city in America. It's not a city that has prioritized homeless folks. Certainly not a city that has shown much care or support for people who use drugs. And we serve people who live at that intersection. The majority of studies participant base is either houseless, precariously housed, or living in public housing. And so, our folks, I think, are very scared about what's happening right now. They are scared that instead of receiving appropriate support, they're going to be punished for being out in the world, which they don't have much choice about. It's particularly hard for people who use drugs because one of the most important harm reduction things you can teach a person is that they need to not use alone. We say that all the time because if you overdose by yourself, there's no one there to reverse an overdose. And Asheville is a place where basically everything contains fentanyl, is contaminated with fentanyl. So there are lots of overdoses, and people having to socially distance it's just not a possibility for the people that we're working with. And what the city has done, despite having lots of money and access to over 8,000 hotel rooms in this county, they've made a decision to, put dozens of very vulnerable folks in the Civic Center. And the Civic Center is a hothouse for infection. People are too close. The people who made the decision to open the Civic Center would not put themselves in that position. They would not put themselves in the position of being that close to other people. We have been made aware that no one has been tested inside the Civic Center. That is, to me, unforgivable. So we have taken vulnerable folks without resources, and we've also put them in a location and said, you just have to just stay in there. If you leave, you also can't come back. But they're not going to provide you any testing. They're not going to make you aware that you have it or that the people around you have it. Certainly staff who are having to work the Civic Center could be exposed to things, could be exposing other people to things. And there's no thought about that. So that all feels very concerning to me. Buncombe County keeps saying that they have less than 40 positive cases. That's an impossibility. There's no way. We have rural counties that surround this county that have twice as many cases. And somehow Buncombe County, that has an airport, again, is the second fastest gentrifying city, is full of hotels. It's based totally on tourism, mostly for folks coming from the Northeast and the West Coast. Just only has 38 cases or something. This is just, it is a bizarre act in denial and looking away to act like we don't have a problem and that we don't have the resources to address that problem. We certainly do.
Absolutely. And I'm curious, I think anybody who lives in Asheville will be like very intimately acquainted with the reasons behind like this kind of denial, but for people that won't, like, what's your opinion about like why the city of Asheville is responding in the way that it is responding?
Well, I think, I mean, there's a confluence of so many factors. Asheville is an overwhelmingly white place, and we know that white supremacy is very skilled in looking away from the truth and making that part of its ethos. So, you know, we have that factor. I think that Asheville sort of has this myth about itself, and myths are very dangerous because once you sort of get stuck in a narrative, you can't step out of that and see what the truth might be. But it has this narrative about itself that it's very progressive, more progressive than the rest of the South, more progressive than Appalachia. And so, you know, it has less problems. And the truth is that Asheville is not progressive. It doesn't have progressive policy. It doesn't have progressive lawmakers, but it keeps saying that it is. And so a lot of problems begin here, go unnoticed, untreated, unaddressed. And we have very, very unsustainable growth and development here, which is actually a feature of most large southern cities. Just go ahead and be real about that. That this trend of gentrification over the last decade in the South, in places like Nashville, Tennessee, and Atlanta, Georgia, it's not sustainable growth. And the infrastructure that we see in cities in other parts of the country doesn't exist here. So we don't really have very good public transportation here. We certainly don't have a good healthcare web that catches folks who don't have resources to pay or have insurance. We just haven't made investments in infrastructure. What we've done instead is to build, 8 million hotels and lots of breweries and lots of things to entertain people who aren't from here, instead of investing in the city itself and the people that have lived here for a long time. We just haven't done that. So Asheville just it's a big bubble, and this could burst it. COVID-19 the problems that are arising right now are not new problems, right? They are being revealed, right? COVID-19, coronavirus are revealing the gaps in the system for the whole country, but that's certainly true here. We just have really failed to invest in the people of this place and of the city itself, and to think about what would be sustainable in terms of growth and how to build a complex economy that can change. It's all based on vacation. So it's a very large resort town, I guess, is one way to say it.
Thank you so much for talking about that. I've just been having a lot of conversations with people who have been butting up against this very problem by virtue of doing the work that they're doing. And for me, it's horrible to see what the city of Asheville is doing, essentially killing people. But it's nice to see all of these issues be thrown into the relief that you were mentioning. And then now I think it's becoming way more apparent, the chronic deficits that we have as a town.
Yeah. And I'll say, I think the problems that we're seeing around testing and healthcare here actually don't feel very new for us at Steady Collective, because there are questions that I've had for a long time about things like Asheville's HIV numbers, which have stayed basically stagnant and the same for many years. And they've stayed the same amidst a really intense increase in overdose and in IV use. So somehow Asheville thinks that we don't have any additional cases of HIV, but we have tons more folks using IV drugs and overdosing. That doesn't work out. That doesn't make sense. So I have a lot of questions about data here and about the way things get reported and what gets suppressed. And I think that what we're seeing in terms of lack of testing here, of course, we don't know all the reasons behind that, but some part of me thinks it's got to be about suppression and about not testing so we don't have results so the tourists will come back as quickly as possible. So the economy, which is totally based on that, can restart. And that is very concerning to me, that we are prioritizing money making and sort of this resort town over people getting sick and possibly dying.
What sorts of changes, and I know like the resource access for houseless folks was not fantastic pre-COVID, but what sorts of changes in resource access have you seen for houseless people in this time of pandemic?
Yeah, it wasn't great here, again, because of priorities and what we're going to invest in and what seems important. But I think that what's changed is that we've lost some bathroom access, which was already hard here. And that is difficult because people then haven't had access to hand washing. Then eventually money was put aside to put hand washing stations downtown and put porta potties downtown so people had access to that. But, I mean, porta potties and hand washing stations are okay, but bathroom access would be really helpful. So we've lost that for homeless folks. We have lost a lot of clothing closets because you'd have to go in and touch stuff. And so, people aren't having access to that. I'm seeing a lot of folks be really upset that they haven't figured out the schedule, right, of when meals are being served or there are changes to that. And so that's been difficult. And I think that thus far, public transportation has been okay. But yeah, I am seeing just that because there are a lot of changes, people are feeling really disoriented. And there's already, of course, a lot of being disoriented if you're living on the streets and trying to make things work. And then all of your resources shift. I think also homeless service providers in this town are nervous about getting in trouble with the city. I think some providers in town have already gotten in trouble, have been told they have too many people congregating, which I actually don't think is true. There weren't more than 50 people at a lot of these places, but a lot of pressure has been put on those providers to move people along or, to eliminate certain dates of when they were giving out food and things like that. So, and that to me is also concerning, that in the midst of this, the city and the county are acting like they're going to enforce things in the same kind of way, or they're going to be just as strict, instead of understanding that this is an exceptional time and changes have to be made, and providers are working with very limited resources and trying to figure out what to do. And certainly the city and the county are not doing enough. And so that it falls, per usual, to nonprofits and mutual aid groups to pick up the slack. And we just have a lot fewer resources than, a city or a county budget. And I think, we've also seen some sort of strange behavior from the county. When this all first started, Steady Collective was attempting to, get our spaces up and running. We had no disruption in service. We were just trying to figure out, what times exactly are we going to be at the locations we're typically at in the vehicle. And I reached out to the county and said, hey, we may need additional supplies. It may be that shipments are disrupted. A lot of our supplies come from Washington State. And at that time, they were really struggling with the response. And I was told, well, we're not going to give you any additional supplies. We are going to go mobile. And I found that really concerning because The county health department here does have a syringe exchange, but they've never done mobile, and they serve about 8 people a day. So they have no experience doing mobile distribution and outreach, and they were going to start in the middle of a pandemic, also without a vehicle. So there were just like lots of concerns about like, why are we doing this? Why are we doing this in the middle of a pandemic? Those sites, Steady is out doing mobile, and there's another exchange across town that is still doing outreach out of their parking lot. The longest running exchange across town is doing that. And then I found out that they were actually just going to set up at all of our locations and do outreach there, which I felt was going to be confusing for our participants. A lot of our participants don't go to the county exchange because they don't want to interact with the government. Law enforcement is present at the county health department, so folks don't want to interact with police since they are engaged in a criminalized behavior. So there were lots of reasons where I was like, I just don't want these folks at our sites confusing our participants. And we've already developed rapport. We're already serving these sites. And ended up having to talk to folks at the state level to try to put the brakes on the county coming into all of our sites. I don't know what all that was about. I don't know if they imagined that we would not be seen as an essential service, and so we would end up having to stop. We are deemed an essential service, so we're going to be operating throughout the pandemic. But we did see like some weird little things, and I'm afraid that most folks who are doing direct service at this time are going to see the government attempt to do some things like this, to overreach, to change things, to enforce certain rules they've never enforced. And I think that folks should be paying a lot of attention to that and documenting it, because changes that happen during this pandemic, could be permanent. So, we need to be watching that.
I think that's such an important point that you just made, and has been something that's on my mind as well, like keeping very, very close eyes on how, city governments, how national governments, how prisons are going to be permanently changing their like mode of operation under cover of this emergency sort of situation. So are the courts still closed, to your knowledge?
To my knowledge, they are still closed.
What sorts of impacts have the courts being closed have had on those in recovery or those in the middle of like legal proceedings?
Yeah, mostly what we've seen has been positive. It's because a lot of court dates have been pushed back, and most of our folks are feeling good about that. So they're not in court right now. A couple of folks that we were working with that were waiting on we're in pre-trial, and so we're in the jail, have been released, and we've seen them, and they certainly felt amazed and glad that they were out and about. So we have seen folks who have been released due to pre-trial. And those are that's been our interaction with jails and prisons and in the midst of this sort of COVID-19 moment, is folks getting out and folks actually just not having a court date.
That's awesome.
Yeah.
Yeah. It's nice to hear like that some folks are feeling okay right now, because I feel like a lot of what we interface with is just this like wall of human pain and misery, and it's nice to hear that people are feeling okay. So you talked a little bit about earlier in this interview about the push to get people hotel access. Would you talk a little bit more about efforts that are going on in that arena?
Sure. So initially here, there were some rooms that were set aside for folks who were homeless to await their results. They had been tested and they were waiting on results in a hotel room so that they could socially distance. What we've seen is our hope was that more and more hotel rooms would be allocated for folks who were just symptomatic, or, certainly we thought at Study Collective, there are enough hotel rooms to put every homeless person in a hotel room today and just call it a day, let folks stay in there, until the end. But the problem with those initial hotel rooms was that we learned that the transport to the hotel room was provided by police. And then we learned that the hotel, which was not located downtown, but a little bit outside of the city, which is a problem because, if you're food insecure and you live outside, then obviously you need the resources that are available downtown, and service providers need to be able to easily access you. So I'm not sure how having a hotel outside of town, far away from people providing food, made much sense. But anyway, people were taken to this hotel, and then we were told that police were guarding it 24/7. So folks left, they couldn't come back. We were told that some people did leave the hotel, ended up being arrested. The charges were later dropped. So what we saw almost immediately was that this news got back to the streets, and our participants, were like, well, I definitely don't want to be tested. And I'm not going to tell anybody if I'm sick, because I don't want a cop to just take me to an unnamed hotel somewhere. And that, of course, makes tons of sense. So, the city started on the wrong foot by that being what's available. And my concern is that as time goes on, the kind of quarantining that's going to happen, unless we apply a lot of pressure, is going to look like the Civic Center, and is going to look like police keeping an eye on people and acting like they're disease vectors and they're in trouble for being sick, which I'm sorry, but is such horrid purity code nonsense. And the truth is that homeless folks and folks who are using drugs are not the people who are most likely to be sick. I think that's the thing we need to be really clear about. They're people who are more vulnerable, but the people who are more likely to have been exposed to COVID-19 are people who can go all over the place, who are super mobile, who have been flying on planes, who've been able to go on vacations in other countries. The people who will be victimized in this are folks who don't have resources, can't socially distance or social isolate, and don't have access to healthcare. But they're not the people who, we don't need to be afraid of them. But already we're just seeing that move of like, these people need to be watched all the time. They don't care about their health. They're not going to make good decisions. They're not going to listen to guidance, whatever. And that's really concerning to me. And I'm afraid we're going to see more and more of that unless we are very watchful and apply a lot of pressure, which people are doing. Study Collective has released a statement demanding that hotel rooms be opened for everybody that needs them, and that more testing be made available now so that we can make better decisions about how to move forward. This is going to go on for a long time. I'm afraid that in the South it's going to go on for a very long time because folks are not listening to orders to stay inside. The folks that could stay inside and have housing are not doing that. I have been amazed that anytime I'm working in downtown Asheville, there are people everywhere. So we have some problems, and we need to know the shape of the problem by providing more testing. And we need to provide hotels now, and we can do that. The city and the county have the budget to do that. The TDA, the Tourism Development Authority, has the ability to do this. They just don't want to, because they want to save those funds to reopen the city and invest in tourism. And that is really heartbreaking. It just is. So I hope that more folks who are serving homeless folks who are precariously housed, people using drugs, that there will be a continued push to open all the hotel rooms. Having folks in the Civic Center is not a triumph. The city has not done everything it can do. It would be very different if we were a tiny little town that had very limited resources and that's the best we could do. It's just not true. We could do much better, and there is a choice not to do better.
Absolutely. And the amount of money that all of the agencies that you mentioned have at their disposal that is going unused, that is going unspent in this time of emergency is just immense amounts of money. So it's not like they can't, it's just like they're not doing it. So how can listeners help support the work you're doing? How can listeners help support Steady Collective if they're in a position to, and how can people get involved in some of the initiatives that you were talking about?
So I think that right now we, along with Other folks in town are asking, and certainly the Asheville Survival Program is asking folks to do this. Folks at the Blade, David Forbes, asking folks to call the TDA, the Tourism Development Authority, call City Council, call county commissioners in Buncombe County, and ask for hotel rooms to be opened. And so I think that push of calling is very important. I think that if folks want to support Steady Collective, we do have a website, thesteadycollective.org, and folks can donate to us. In terms of material needs right now, we certainly can use more masks for participants. We have some PPE for staff, but just basic mask, even cloth mask for participants is very helpful. Gloves for participants are helpful. And breathing barriers, which is another thing. CPR breathing barriers, this is sort of an overlooked thing and is not a thing we typically purchase. And I think it's a hard thing to find right now, but people are more reluctant to provide rescue breaths during an overdose if they're afraid they're going to contract COVID-19. So we really want to make sure every time we're giving naloxone to a person that we're also giving them a breathing barrier and explaining that will be some protection against the transmission of the coronavirus. We're even seeing some states where they're just instructing people not to provide rescue breaths and instead call 911. That's not really a good option here necessarily. We do know that for a long time there's been dual dispatch here. So EMS and the police kind of show up together to an overdose. And of course, some criminalization can happen with police being present. And also Mission Hospital is not a great resource for folks who are using drugs. And that's a whole nother interview. But breathing barriers are a big important thing right now. So if folks have access to those, we'll certainly take them. If folks want to donate money, all of that money at this point is going to be used to buy sort of additional supplies that we're handing out. So feel free to go to our website, thesteadycollective.org, really push for hotels here. I would say if you're in another city and you're seeing municipal governments attempt to come up with some other solution besides hotels to really push for hotels, we're seeing that push in places like Baltimore and San Francisco. In San Francisco, the city initially made the horrible decision to put people in a place like the Civic Center, and 70 people got coronavirus who were in that facility. We're very afraid that that's going to happen in other locations. They're really pushing for individual rooms like hotels or even dorms is what we need to have happen. So pushing for that locally and also in the city that you're in, and pushing for tests. People deserve to be tested. And certainly if the city is not going to provide people with appropriate ways to socially isolate at this point, they need to be giving them tests. They deserve tests because the city has failed to give appropriate resources to make social distancing possible. So, yeah.
Thank you for going through all that. I hadn't thought about CPR, breath guards, and I think that sounds like a really important thing for people to have on their radar as well.
If folks want to mail those to us, our P.O. box is listed on our website, and we're happy to pick them up there.
Cool, that's awesome. Those are all of the questions that I had written up. Is there anything you wanted to give voice to in closing or speak on anything that we missed?
I think one thing that I just am sort of anticipating as a harm reductionist, and certainly, harm reduction is a movement that came out of, harm reduction for drug users is a movement that came out of the HIV/AIDS epidemic in the 80s. And so harm reductionists kind of know how to respond to crisis, and we had been sort of in crisis mode before the coronavirus response even started, because there are so many overdoses out here in Western North Carolina and such a lack of access to health care. But I anticipate that we are going to see an escalation in overdoses in the coming months. And Buncombe County already has one of the highest OD rates in the state. So just being thoughtful about how we can provide additional support to folks who are using drugs, using opioids, coming in contact with fentanyl through their drug use at this time. And I think it's a hard time for folks because people are losing access to medication-assisted treatment, losing access to Suboxone, losing access to doctors, to recovery groups, to other treatment options. So to figure out ways to support folks who are using drugs in this time and to anticipate that overdose rates are going to rise. We haven't seen that rise here yet. The rise that we are experiencing is one that started at the beginning of the year and was related to some other factors. But I do think another rise in overdose is happening. And so it's a very scary time for the folks that we're serving. Mm-hmm. And so I hope that we can figure out ways to support them in this time. Yeah.
Definitely. Thank you so much for your time and your willingness to come onto the show. I have, nothing but a huge amount of respect for the work that I see y'all doing. And I know that the people that come and take, are benefited by Steady's resources are extremely thankful that y'all are out there doing what you're doing.
Glad to be doing it. Yeah, really glad to be doing it. Thank you so much for having me on here.
If you are concerned about hotel access for oppressed populations, you can call the Tourism Development Authority, or TDA, at 828-258-6111, the County Commissioners at 828-250-4066 and leave a message, and the City of Asheville, who funds the TDA, at 828-251-1122. to demand free and safe housing for all who are at most risk of harm due to COVID-19. You can also find ways to support the Steady Collective by visiting their website, thesteadycollective.org. Visit our blog or show notes to see an interview Bursts did with Hill back in 2018, which was done at a time when the city was threatening to close Steady's operations. You can find that by scrolling down on your phone or visiting thefinalstrawradio.noblogs.org.
And now an update from the inside by anarchist prisoner Comrade Malik.
Greetings, comrades. This is Comrade Malik of the Incarcerated Workers Organizing Committee with my COVID-19 update from behind enemy lines at USP Pull-Up in Louisiana. Hustle and motivate. That's why they follow me. They think I know the way. Rest in power, Nipsey Hussle. The marathon continues. Peace and blessings, sisters and brothers. Today is Saturday, April 11th, 2020. I do have an update to provide you with, but first I am sending out a shout-out to some individuals and organizations in the free world who have gone the extra mile to support us and amplify the voices of incarcerated human beings in America. First, I send out a big shout-out and a clenched fist salute to our comrades at Kiteline Radio in Indiana. Kiteline has shared my reports and reports of numerous other prisoners who are facing the COVID-19 pandemic. Thank you, Kiteline, for broadcasting our voices. Free Comrade Kwame Shakur. Free Comrade Kevin Rashid Johnson. Free them now. My second shout-out is to the Rock Nation and Team Rock. I'm sending out a specific shout-out directly to rappers Jay-Z and Meek Mill. I want to personally thank Jay-Z and Meek for donating literally thousands of protective masks for prisoners housed in U.S. prisons and jails. Thank you, Jigga, and thank you, Meek. We love y'all. In the land of the free were the blacks and slaves. 3/5 of a man, I believe, is the phrase. Jay-Z's grandma said, baby, watch what you say. They're going to have to kill me, Grandma. I ain't never going to be their slave. Oh, say, can you see? I don't feel like I'm free. Locked down in a cell, shackled from ankles to feet. Oh, y'all thought your boy Comrade Malik was going to start rapping? Gotcha. Now back to the report. All right. I have a progress report to provide in regard to how some governors and prison officials are responding to our national call to free our elders. On Thursday, April 9, 2020, Louisiana Governor John Bel Edwards made a very interesting announcement during his daily COVID-19 briefing. Governor Edwards said that on Tuesday, April 14th, the Louisiana Department of Corrections would begin to evaluate older state prisoners for placement on furloughs or home confinement. Specifically, Governor Edwards said that state prisoners over 60 would be evaluated by a board consisting of members from various law enforcement backgrounds. From the list of these individuals doing the evaluating, not one individual would be considered friendly toward prisoners or their family members. I recommend strongly that we keep a close eye on Louisiana and the state of Texas. I want all of you to know that Alvaro Luna Hernandez is a long-held politicized prisoner in Texas. He is an elder who is suffering from hepatitis C. We need to free Alvaro now. Free him. He deserves his freedom. We don't want him to die of COVID-19 or any other disease while he's incarcerated. Free our elders, please. Free Alvaro Luna Hernandez. Both these states, Texas and Louisiana, have long histories of incarcerating a disproportionate number of Black and Latinos in their prisons and jails. Sisters and brothers, I want you to think about something for a second. COVID-19 is killing Black people in Louisiana and all over the United States at an alarming rate. If prisons and jails in America are jam-packed with Blacks, don't you think we should continue to advocate for our people and their release? If we don't advocate for our people, who will? Sisters and brothers, on Friday, April 10th, Louisiana Governor John Bel Edwards was caught flat-footed when a reporter asked him what the state of Louisiana was going to do to help prisoners at the federal prison in Oakdale, Louisiana. Governor Edwards personally hasn't shown any interest in saving the lives of federal prisoners trapped at FCI Oakdale. The death toll is going up and up at FCI Oakdale. We are hearing that there have been 7 to 9 deaths, and that COVID-19 is just running rampant throughout the FCI Oakdale. Governor Edwards might not care, but I care. And I'm calling Governor Edwards out for his inability to evacuate the prisoners at Oakdale. With all due respect, Governor Edwards, I demand you save the lives of prisoners being ravaged by the COVID-19 epidemic at FCI Oakdale. Get them out of there now. Before I end this report, I want to send out a shout-out and tender love to Tia Hamilton of State vs. Us magazine. Tia Hamilton helped organize a call for the release of prisoners all across the United States. State vs. Us magazine is one of the premier magazines which focuses on criminal justice reform. If you haven't read State vs. Us magazine, I suggest you go pick up a copy today. I actually interviewed Tia Hamilton recently, and my interview with Tia Hamilton will be appearing soon in the San Francisco Bayview National Black newspaper. The San Francisco Bayview National Black newspaper is the baddest black newspaper in the United States. And if you haven't subscribed to it, you're all wrong. You need to check it out. www.ffbayview.com. I want to thank all of you for your unwavering support. This is Comrade Ali at USB Polo, signing off. Please take care of yourself and stay safe and healthy. I love you all. Goodbye.
Hello, my name is Noelle, and I'm Jason Walker's girlfriend. I'm gonna read his answers to the Final Straw Radio questions. So here I go.
Would you please introduce yourself for the audience? Feel free to include any details about your background, political affiliation, or current circumstances that you think will give good context for the conversation.
My name is Jason Renard Walker, Minister of Labor for the New African Black Panther Party, Prison Chapter. I consider my political stance as a reflection of our party's rules of discipline, principles, adherence to our 10-point program and platform, and our goals for the future. For clarity, please feel free to learn about what I mean by viewing the United Panther Movement section of my website at www.jasonsprisonjournal.com. Just for the record, I don't see myself as Democrat, Republican, anarchist, communist, or socialist. I know this seems contradictory to the circumstances, but I'm all about positive change for society and the future of those to come. The New African Black Panther Party's effort to carry on the legacy and goals of the original Black Panther Party is my higher calling. And regardless of not holding an official political stance, my ability to execute my duties and help build the party would be the same if I did have a political stance. Though I am certainly anti-imperialist and anti-capitalist.
Would you mind telling us about your past, the case you caught, and an overview of the conditions of your incarceration in Texas?
Just like a majority of our comrades and party members, I am a product of my environment. The streets of East Oakland, where I grew up, is riddled with drugs, street gangs, violence, prostitution, and so on. If members in my family weren't drug dealers, addicts, pimps, cons, prostitutes, and so on, then they held impractical religious views, empty of practical solutions, coupled with the preachings of prayer and belief under the banner that this alone would make me a successful member of society. The latter did little to persuade me from following the footsteps of people I admired, which were drug dealers and crooks that had more than their fair share of wealth and stability. While the so-called true believers toted the transit bus to spend their welfare checks and food stamps, not only did I witness these contradictions within my neighborhood, I witnessed them within my own family. By the age of 14 in 1994, I had dropped out of school, became a full-time criminal, and began experiencing the consequences of my actions. After spending 2 years in detention centers and a group home in Gilroy, California called Advent Group Ministries, I moved to Garland, Texas with my grandma to stay with my aunt and my cousin in 1998. This was supposed to be my transformation from a criminal to a productive member of society. All this did was transfer a career criminal from committing crimes against the poor to committing crimes against the unwitting rich. There was no plan to rid me of my thoughts and behavior, so I brought them with me to places no one knew such incivility existed, making these people easier and more fruitful targets of burglary, scams, drug deals, and armed robbery. I received an 18-year sentence in 2008 for robbery and have done 12 years on it so far. Since then, my outlook on life has changed. From my own experience and from what I read, conditions in Texas prisons are far worse here than most prison systems in the U.S. What gives Texas the edge is that it's an overtly for-profit only system. Prisoners undergo unpaid forced labor. They grow, harvest, and tend to the food we eat, and work and operate everything short of running the cell blocks. I give a vivid account of these conditions on my Kindle ebook on Amazon.com called Reports from Within the Beast, Torture and Injustice Inside Texas Department of Criminal Justice. I recommend that all your listeners get a copy. The writings span the year 2010 to 2019, including some of my work during the 7-year stay in solitary confinement.
We've seen your journalism featured in the SF Bayview National Black newspaper. Can you talk about your publishing, feedback you've gotten, and repression that you faced for your expressions?
The San Francisco Bayview National Black newspaper has been a big supporter of my writings. If they weren't publishing journalism by me, they published journalism about things concerning me and the bad conditions prisoners are facing in Texas. This includes our organizing and supporting the 2016 and 2018 National Prisoner Work Stoppages, and the reprisals we faced for doing so. Not only had my journalism in the Bayview drew the hatred of some guards, it has drawn negative feedback from white supremacist groups that conspire with these same guards to smuggle illicit drugs into the prison, namely the deadly drug K2. In the October 2018 issue of the Bayview, I wrote an article called Prison-Assisted Drug Overdoses. This forced Texas officials into giving guards more scrutinized searches before entering the prison, including the use of drug-sniffing dogs. Guards have used my article as a manipulation tactic to raise smuggling fees by suggesting that my article in particular has made smuggling riskier. In turn, I've been confronted by random individuals and groups about the article. These same individuals admit not having read the article, so they are ignorant to the message I deliver. I've even tried suggesting they read the article, but to no avail. It only exposes ignored prisoner overdosing. They are completely reactionary and tend to gravitate towards what guards tell them, like I've been confronted about being a child molester, racist, terrorist, CIA operative, and instigator, with evidence supposedly being in the law library and wherever the guards supposedly found the information. Combating this has been quite easy. I also have gotten a lot of positive feedback from other journalists and Bayview readers in the U.S. and Europe who have become supporters of my work and who have chosen to investigate the conditions I describe in my articles.
You recently published a book entitled Reports from Within the Belly of the Beast, Torture and Injustice Inside the Texas Department of Criminal Justice, that among other things compiles some of your writing you previously published. Can you talk about your method of organizing your writing, who your audience is, and what you hope the book will achieve?
I really don't have a method of organizing my writings. I tend to first document times and dates on things I see or learn of. I seek witnesses and victims who are always willing to let me write about them. Sometimes I'll ask a guard about something. Most of the instigators and abusers will openly brag about what they did. At the time, they aren't aware that an article will be written or who I am. After the hammer comes crashing down, they face me with looks of betrayal, as if I'm not supposed to expose them, because they may have given me extra food or recreation time in the past. Guard Darius Reed stole a Bayview, and it mentioned him. I have a large audience that includes Bayview readers, the Houston Chronicle, the Texas Tribune, SolitaryWatch.org, the Anarchist Black Cross Group, Industrial Workers of the World, Incarcerated Workers Organizing Committee, and hundreds of people who have never written me but have sent me books and magazines, like Sherry Black and Sam Rosen in Great Britain, or those who send words of encouragement but fail to provide a reply address. The message in the book speaks for itself. I hope and wish that it gets in the hands of as many readers as possible. I haven't found a book by a Texas prisoner of this magnitude like it. It also includes unpublished articles, a foreword by prisoner supporter Sam Rosen, introductions by Maggie Ray Anderson, a 2019 Central Washington University graduate who got a BA in Law and Justice and a BS in Social Services, as well as Kevin Rashid Johnson.
Do you have any plans to publish a book in physical form so it can be available to people in prison?
We are in the process of publishing the paperback version, specifically so that prisoner supporters can have a copy sent to an incarcerated loved one or friend. These copies will be available on Amazon.com. The ebook and the paperback version have come to fruition by the funds and work of myself and my girlfriend, but we could use the help of an underwriter or an independent publisher.
A year and a half ago, we had the pleasure of speaking with Kevin Rashid Johnson of the New African Black Panther Party prison chapter about organizing that he was doing, about the prison strikes, organizing on the outside, and his organization. Would you talk about how you came to the NABPP, what your position in it is, and how organizing in Texas has been as a member of that group?
Given the circumstances, it would be difficult for me to answer this question without this entire questionnaire being banned by the mailroom, not because of the content, but to delay the radio interview entirely under the false pretext that it contains security threat group information. Some insight can be sought by viewing www.rashidmod.com.
Are there any other groups you've organized with that you'd care to mention? For instance, you received punishment in the aftermath of the nationwide prison strikes in 2016 and 2018.
Yes. During the 2016 and 2018 National Prison Work Stoppage, I had the joy to work with the IWOC, different branches of the ABC, the Free Alabama Movement, and a group in Colorado that published the Fire Inside zine, which I wrote a piece for. The Fire Inside zine related to the 2016 work stoppage.
A common concern raised around incarceration in the U.S. is a lack of medical treatment, the high cost and low quality when it is available, overcrowding and understaffing leading to medical and health emergencies. I've noted on the outside that the conversation is more frequently raised recently during ecological disasters like hurricanes or when people protest the use of solitary confinement in lieu of mental health resources. But now, with the pandemic and obvious lack of preparedness around COVID-19, novel coronavirus, can you talk about health and preparedness in terms of incarceration in the U.S. and what the public on the outside can be doing to support folks in cages?
I'm glad you brought up the coronavirus. I just recently wrote a short piece on the lack of care we are provided in the midst of this and the prisoner's failure to receive care to avoid paying $13.55 medical copay fees. Since I wrote that piece, 5 prisoners were moved to this prison with coronavirus. They received it from a sick guard during transportation. Now guards at this prison have been confirmed to have it. It is spreading. My request to be tested because I'm showing signs of illness have been ignored. I submitted my request 4 days ago. Today, April 5th, nurse Miss Spencer came to see me. I was told I didn't have a fever, so no future care was necessary. There is no obvious plan in place to prevent further spreading. Guards are wearing masks, and there are notes posted about staying 6 feet away from others. Though we are confined to ourselves with another prisoner and have no way to read any postings that are located places beyond our sight and walking authority. I've learned that taking vitamin C supplements and drinking citrus-flavored electrolyte drinks slow down the manifestation of the germ, along with limited physical activity, lots of sleep, and staying warm. One key thing people on the outside can do for us is to constantly contact the prison's warden about the number of confirmed cases, requesting our medical records as to monitor their response time to our sick call requests, our diagnosis, and the type of treatment we are receiving, sending us updates on how it's spreading in our particular area and any info they have that can help prevent spreading and exposure. Hair scanning is the only prevention plan being implemented here, whatever that is. We are being given false info on self-diagnosis and testing. One thing that has to be a public concern is how nurses use our blood pressure results to determine if we are sick, hurting, having a stroke, and whether we have a common cold or the common flu. I actually describe one instance in my book concerning a stroke victim who was denied hospitalization for over 12 hours based on his blood pressure results. He is now paralyzed and had to undergo brain surgery because of the long delay. No staff were held liable. They actually brought him back from the infirmary on a gurney and laid him on a cell floor where he remained until we convinced the next shift that he was dying. This incident occurred here at the Clements unit. My advice to prisoners is to take matters into your own hands. If you feel you are sick and in need of medical care, keep trying to get it. Don't let nurse staff suggest your blood pressure is the factor, whether you are sick or not. Don't let medical copay fees factor in either.
Are there organizing efforts in Texas around prisoner issues that you'd like to highlight or needs that need to be addressed that are particular to the TDCJ or any of the units that you've been kept in?
The only organizing efforts I'm aware of are the ones involving the NABPP, the IWOC, and scattered anarchist prisoners in Texas. Since I've been in close custody, 2-man solitary, I haven't had the chance to use the phone, limiting my access to information. In fact, incarcerated anarchist Julio A. Zuniga, also known as Alex, is at the Darrington unit in Richardson, Texas, organizing. His focus seems to be on conditions, medical care, filth, the treatment of the mentally ill, and gladiator fights. Final Straw listener Matt Broadnax did an interview with Alex that is published online. But there are many organizing efforts by unknown Texas prisoners who too face unwarranted acts of repression, including the destruction of outgoing and incoming mail. and personal property. I've met several during my stay at the Ellis Unit, Michael Unit, and Allred Unit. Their lack of firmness in the face of reprisals have kept their efforts to organizing limited to filing grievances and complaining amongst each other. In these circles, I'm viewed as radical and going too far, though they wonder why they can't win false disciplinary cases. We need more isolated and groups of prisoners to take their organizing to the next level. If using unradical forms of organizing was effective, not one prisoner would need to take things to the next level. These groups must form bonds of unity as well. For example, a lot of prisoners chose filing civil suits, challenging the 13th Amendment clause on legal slave labor. This was in response and following the 2016 work stoppage. Their focus was on losing commissary privileges, dayroom time, and whatnot. So to circumvent foreseeable retaliation and applying some serious action, they used the government's recommended channel, getting each of their claims dismissed as frivolous, wasting both time and their own resources. In a few instances, some prisoners did file civil suits and participate in the work stoppage, but even the civil suit filers learned a valuable lesson I hope that they are building on.
Where do you see the efforts in the U.S. around prisoner issues? Similar to the prior questions, do you have any inspirations or challenges you'd like to pose to either those on the outside or the inside?
Efforts to organize in the United States around prisoner issues are scattered, contradicting, and often misunderstood. You have some prison writers out there labeled as activists, though their writings and disinterest in footwork reveals their black capitalist, white capitalist, brown capitalist interest and agenda. You have others still engaged in the sale of drugs that hold a street mentality called revolutionary but gangster, allowing them to engage in some activism while holding the same criminal mentality and worldview that their activism supposedly opposes. It's the do as I say, not as I do thing. The challenge to prison activists inside and on the outside is to stay firm at what you do, continue learning how to strengthen your organization and or support circle. Educate those around you about your program and be a positive representative in your community upon release, helping them thrive. For instance, the NABPP has transitioned to the outside. Comrade, Chairman Shaka Zulu, and others have created our outside headquarters in Newark, New Jersey, giving us the opportunity to create and expand our Panther community service programs. This includes our Black August, BB9, No Prison Fridays protest, and free food, breakfast, and lunch program that occurs Saturdays between 10 a.m. and 4 p.m. These programs are sponsored by Panthers and service community volunteers. Shaka Zulu helped bring this to life upon his release from prison. As it shows, the NABPP is among the most firm in regards to in-prison activism, organizing, and carry this on in the oppressed and impoverished communities. The role of the NABPP is not to pose as a rescuer of the people, but to uplift, inspire, and teach them. Through their own cooperation and collective power, they can solve their own problems, meet their own needs, and free themselves from the racist, exploitative, and oppressed society.
Are there any subjects that I failed to ask you about that you'd like to speak on?
No, there isn't. But I'd like to take time to thank everyone that has helped me with my progress, education, development, and needed support. Too many to name here. And a $1 donation will be given to the San Francisco Bayview for every paperback issue of my book sold. Jason Renard Walker, number 153-2092, Clements Unit, 9601, Spur, 591, Amarillo, Texas, 79107.
Jason Renard Walker mentioned an interview with Comrade Z, aka Julio Alex Zuniga, currently held at Darrington Unit in Texas. IGD conducted an interview with Z a little ways back that we'll link in the show notes. In midweek, soon after this broadcast, we'll also be releasing an interview with Comrade Z, kindly voiced by Pearson from Coffee with Comrades, alongside an update from Jason Goodlock on his case and COVID-19 at Toledo CI in Ohio, and anarchist prisoner and contributor to Fire Ant Journal Jennifer Rose speaking about her case and her situation. Fire Ant just put out its 6th edition, which is available online and linked in our show notes as well. As our 10th anniversary is just around the corner, I'd like to reiterate our invitation to support us by sharing words and experiences you've had as a listener as relates to the show from over the years. If there's a book that you were turned on to, organizing you undertook, a friend or comrade that you met, or a favorite Sean Swain segment that you'd be willing to share with us and the listenership under a real or assumed name, we'd adore to hear it. You can reach us via our emails and P.O. Box that we'll list momentarily. You can also send us a Signal voice memo to 828-571-0161 or send us a link to a recording via Google Voice or WeTransfer.com. That number will be linked in our show notes. This is The Final Straw, and I'm Bursa Goodness. This show will later be archived at thefinalstrawradio.noblogs.org, and you can email us with questions and suggestions at thefinalstrawradio@riseup.net or thefinalstrawradio@protonmail.com. If you'd like to use any episode for your project or radio show, feel free to do so. Just send us an email to let us know. If you care to, you can send us letters at The Final Straw Radio, P.O. Box 6004, Asheville, North Carolina, 28816. This show is brought to you by Firestorm Books and Coffee. Located at 610 Haywood Road, Firestorm Books and Coffee is a worker-owned co-op in Asheville specializing in offbeat, underground, and independent literature. You can find a catalog of Firestorm's books and zines, plus a full calendar of events up at their website, firestorm.coop.